Welcome to My Health Wake Up Call, a podcast sharing personal stories. Today we have Diane. She's going to share with us her success story. It's very inspiring. And she shared on our Facebook group. We have a group called DCIS is Not Breast Cancer with almost 4,000 women now. So women are seeking, inspiration and insight, and hearing stories such as mine and yours over the years, I think is so helpful because it's a challenge. This diagnosis of ductal carcinoma in situ, known as DCIS or stage 0 breast cancer. It's very confusing, sometimes called precancer or, the earliest form of cancer. In our group and mindset, we don't believe it's cancer. And the studies and the research proves that the majority, up to 86%, never becomes cancer. So we're a little bit ahead of the medical community. So I'm going to invite Diane to share her amazing story. And I thank you so much for being here today, Diane.
Oh, you're very welcome. It's a pleasure to be here. I'm very anxious to kind of get my story and the word out. So I don't even know where to begin here. It's such a long journey. I want to preface this by saying that I am almost 5 years out from my diagnosis. And basically, I declined the standard of care totally. I declined radiation. I declined surgery. I declined the pill, much to the dismay of my local medical community. It started back in February of 2021 during the pandemic. Now, prior to that, I had gone to a local hospital for my mammograms from 2008 all the way up to 2021, and nothing ever showed on their end. They just saw calcifications where they really didn't see any change. So my insurance changed in 2021. I was no longer able to go to the same facility, but I did pick up the last couple of years of mammogram films when I went to the new facility so that they would see that the calcifications they're seeing are something that I've had for 15 years or however long that was from 2008. So I went to the new facility and immediately I was called in as soon as they did the mammogram, and the radiologist said that he saw abnormal clusters of calcifications. He didn't think it looked normal. He said to me that he did not believe that it was cancer. He says, I'm looking at it. I don't believe it's cancer, but I'd like to just be on the safe side to do a biopsy. And I questioned, well, if you don't think it's cancer, why are you suggesting a biopsy? And he said, well, just to be on the safe side. So for a while, I thought, no, I'm not going to do it. I'm not going to do it. And then I thought, okay, I'll do it, because I anticipated, of course, getting a report back saying that it was clear. So in May 4th, actually, of 2021, I had the biopsy, which was a horrible experience, to be honest here. And it was just about 2 days after, which kind of surprised me because I thought it normally took longer than that. I did medical transcription for 20 years full time. So I was a little bit, I've typed about DCIS, breast cancer, but I typed it, but I never really paid any attention to it because it honestly didn't pertain to me. So 2 days later, I get the infamous phone call. I woke up, they were on my answering machine, the outpatient facility, called me back. I did, and I hear, you have breast cancer. Oh my God. That is what I hear. So your heart just kind of sinks. I start crying. The first thought is you just kind of get hysterical here about it. I'm like, I cannot believe this. So
over the phone. So they did this over the phone. You have
over the phone. They called me and told me
you have breast cancer over the phone.
You have breast cancer. So
did they ask you if you were driving? Imagine.
No, because I think they probably did know it was my home phone because I had my home phone and my cell. And I did call them back from the cell, but they're like, you have breast cancer. I mean, no elaboration. So then after I kind of composed myself, I called them back and started to ask questions about it. What type, what was the area that they saw? And basically I was told to follow up with the breast surgeon. Okay, I really wasn't given any answers, follow up with the breast surgeon. So before I had the appointment with the breast surgeon, I get a call from the nurse practitioner, which would scare anybody except I did medical transcription, so I knew. I get a call from the nurse practitioner at my PCP office saying, we have to get you scheduled right away for a CAT scan, for an MRI, for a full body bone scan. So anybody else would think, oh my gosh, is this like in my bones? Is this in my organs?
Terrible.
Why is she asking me to do this? And I said to her, no. I said, because at this point I did have a couple of days to research it. I said, this is not even into my breast. If it's not into my breast, how in the world could it possibly be into my organs or into my bones? So no, I refused that, and I made it real clear. I did not ever want to see that nurse practitioner again. You know, I will see the doctor from now on, because evidently she has no clue about DCIS. So I go to the breast surgeon, and honestly, he was considered the top breast surgeon in my area, and I live in Pennsylvania. And so I go, and he has the drawing on the blackboard saying, we have two choices here. We can do lumpectomy, and then followed by 26 rounds of radiation. We'll refer you to an oncologist to prescribe. He didn't say, I can't remember whether he said tamoxifen or another drug. I honestly can't remember which, but the oncologist to prescribe the drug. And he says, problem gone. He goes to the next blackboard and says, or we can schedule a mastectomy. We can schedule all of this next week. Which do you prefer? We do the mastectomy, problem gone. At which point I said, well, doctor, just because people do mastectomies doesn't necessarily mean that they don't die of breast cancer, because there are people who die of breast cancer. They get the mastectomies, but a cell escapes, goes into their bone, goes into their organs. And I said, actually, doctor, there is a third choice, and that is called monitoring. I said, I've been doing my research. I've looked into what other countries. They're not even really considering this cancer at all. I said, I was looking at the SEER study, and I understand that a COMET study is underway. And he never mentioned it till I brought it up. And when I said the COMET study, he said, oh, my associate, one of his employee doctors who works under him, was actually in the COMET study at that time. He says that he will refer me to the associate, since she is in the COMET study, and get me into the COMET study. So, I mean, I was prepared for him, and I said, well, doctor, is it not so that if I do the radiation, that once you have radiation in the breast, that if it does go into invasive down the road, that I could never get radiation on that breast again? And he wanted to know why I wanted to know. And I said, well, I already knew the answer. I really didn't need confirmation of it. I just wanted to bring to his attention that I knew this. And I said, and also, if I get radiation now on my breast, I said that if down the road it would ever move into invasive, then I can never get reconstruction either, because the tissue is damaged. So I think he was a little taken back that I did know this.
You knew a lot more than most people.
He did confirm this. So at that point, he did refer me to the person who was in the COMET study. So I made an appointment with her.
Is that someone that was leading the COMET study or in it as a patient?
No, she was leading it from that particular.
Okay, she was a doctor.
Yes, she was a doctor that worked right under him, but she was the one that was in the COMET study.
Gotcha.
So they said that it was randomized. So unfortunately for me, when it was randomized, they had me in the surgery side. Yeah, which is a no-go. So I told her, no, I'm opting out of the COMET study. So she said that she would kind of follow me off the record, right, for the COMET study. That's
what they have to do.
So, so we started like that. And when I went for a 6-month follow-up, I mean, they did probably like at least four images, maybe even 5 of that breast, which cannot be real healthy, all that, radiation. And every time that I would go, she would say that the area is getting bigger. The DCIS, is growing. So I don't know whether it was my second or third visit with her. She said that it was 2.7 centimeters, which I started out with only 1 centimeter. So I said to her, I was reading the biopsy report, and I saw that the area that you did the tissue biopsy on was 2.5 centimeter. That was the tissue area that you biopsied. with the vacuum assisted needle. I said, so could it not be that what you're seeing isn't DCIS at all? It's this scar tissue. Could this be scar tissue? Because it's too close to the area that they suctioned out. It was just too close in its diameter. So she says, yes, it could be. That was the answer. Yes, it could be. But she said the only way that we would know for sure would be to do an excisional tissue biopsy. No, that absolutely is not going to happen.
Wow.
So when this first started in February 2021, okay, by November 2022, when she said it was growing and we came to this point and I still kept refusing surgery, I was basically dismissed from care.
Wow.
She said that I would no longer be a patient because, basically I'm not doing what is recommended. So she would not even order the mammograms for me anymore. I received a message from her through the MyChart app or something affiliated, with the MyChart, saying that my PCP could order the mammograms from this point on. But actually, she said that she really recommended an MRI. So I just decided at that point, forget it. I'm not going to do the mammograms. I'm done with the mammograms. I read all about the radiation, and I was bullied. I cannot tell you how badly by the radiologist. Every 6 months when I went in, so you figure in that time span, I at least went in 3 times, from the initial diagnosis, every 6 months for at least 4 to 5 films of that breast. And every time the radiologist would call me in, I felt like I was being bullied. I was basically told that I'm a ticking time bomb. Do I realize that the chance that I'm taking, that I'm risking my mortality, just this and that? I was bullied so much, and I just did not want to even, go through this again. I want to go back to the biopsy. What they don't tell women is that, a lot of times I don't believe they tell women that they're putting titanium markers in their breast, but I knew because I typed the reports. So when I went in for the biopsy, I made it very, very clear, no titanium markers. I have very sensitive skin. I get reactions even to hand dispenser soap in public restrooms. So I said no. So she said, well, we're going to have the radiologist come in and talk to you. I thought, whatever. I told her, fine, but I've already made up my mind. There aren't going to be titanium markers or I'm not going to do this. So he came in and explained the purpose of the titanium markers so that they can see. Well, I'm sure that they can see the area that they did the sampling on. I don't think you need the titanium markers. So I just confirmed with him, no. And I told him, he asked me why. I told him, I'm very sensitive. I do not want those in me. I don't want a reaction down the road, which I was told, if you can believe this, if you have a reaction to the markers, we can go in and we can take them out at a later date if you have a reaction.
Oh my God, which is not easy. Actually, a lot of women have problems and they contact me because they can't find a surgeon. There's only one surgeon in Florida that I know of that will do that. It's challenging. So you had so much knowledge, thankfully, because think about if you didn't, most of these women, thousands and thousands, don't have the knowledge. So you're sharing this is so important because women need to know they have to have informed consent. And what you're saying is most are not, because, in my case, you don't even know. They might tell you, but it's along with 20 other things. And you're so overwhelmed that you don't fully understand it. So that's not truly informed consent.
You don't, because your nerves are on edge. You're signing, you're signing a paper. But there was no way that they were going to put these markers in me. And actually from typing reports, I have typed reports where women said that they have moved, they have migrated. Some tell me, they didn't tell me, I would type the reports, that they moved so close to the surface of the skin.
I've heard that
they were afraid that they were going to poke through. But like I said, I was told, well, we can take them out at a later date. Well, no, that's not going to happen because you're not going to put them in the first place. So I went to the oncologist about, the tamoxifen, or there was another drug that they had said it was not tamoxifen, but it was along the same lines. And the oncologist, he did not try to force me on it. He was very nice. He understood that I really didn't have any desire to go on this. He said that if I ever changed my mind, that I'm open, to going back. He was very, very nice, because my question was, I had my right ovary out in my left ovary out in 1993. And then about 7 years ago, I noticed on my mammogram that there was a cyst that grew on the other ovary that doubled in size in a year. So I thought, oh, I'm in my 60s. I'm not going to wait for it to become something. Just take it out. So, having the DCIS being ER/PR positive, and I know that that's fueled by estrogen and progesterone. So my question to everybody was, what could possibly be fueling my DCIS? I mean, actually, I was diagnosed with grade 2. It was
I was going to
medium
ask
risk.
that. Yeah, which is considered low risk. That's why they sent you to be eligible for the COMET study.
Right.
And so the difference is one end was mastectomy, the other end is monitoring, basically doing nothing. And that's extreme.
Or, like I said, or lumpectomy, 26 rounds of radiation. On the left side, on the left side where my heart is, I basically told the doctor when, I did tell him that I knew if I had radiation, I would never be able to get it again on that side if down the road it would become invasive. Yeah. So basically,
why do they not tell people that? They don't tell women. You knew that because you've typed it up as a transcriber.
Exactly.
But that's really unfair to women to not be told that, because, there's a percentage that will go on to have invasive cancer, and then that's not a possibility as an option for treatment.
You're taking that option away. Honestly, Donna, I told them, and I put it just like this, that since I really only have one chance at radiation on that breast in my lifetime, I said, I choose not to waste it for something that is not even there.
Right.
That's the best way that, I can put it. It's not even there. So my question was, what could possibly fuel my DCIS to grow when I'm in menopause? Number one, at that point, you figure 5 years ago, I was 64 years old and I had 0 ovaries. So there was nothing to fuel it. So then I started to read that what could fuel it is fat cells, could possibly fuel it. So what I did, I went to a local wellness center and I lost 30 pounds.
Good for you. Fantastic.
I lost 30 pounds. And I may gain like 5 pounds back, but then when I gain it, I go to the wellness center and then we take off the 5 pounds. But I pretty much stay within the, same realm. I did a little outline to make sure that I don't miss anything here, that I wanted to.
Yeah, and that's another thing that they don't tell anyone diagnosed with DCIS. When I asked if I could do anything different with diet and lifestyle, I was already very healthy. The nurse said to me, oh, no, you don't need to do anything different. There's nothing that, your lifestyle, there's many people that are healthy that get this. And then she said, but would you like a prescription for Xanax? So now not only are they not giving women, health and wellness advice and lifestyle and known cancer risk reducing, preventative things they can do, just through nutrition and exercise, they're offering very strong benzodiazepine drugs that are addictive. And I knew about that because my mom was harmed by it. And so that's like, now you're getting drugs and then upon the tamoxifen, they're trying to get many, many women to take. 71% of the women in the COMET study doing active monitoring actually took the drug tamoxifen, because most women listen to their doctors and they're afraid. You're someone who knew some of these things that are not disclosed. And so you saved yourself from having more harm. Even the incisional biopsy, they said, they did that to me. They said, you need a surgical biopsy. We need a bigger sample. And I didn't know better at the time. So, good for you. And thank you so much for sharing all this, because it's your knowledge and then your, 5 years of experience where you defied doctors who were scaring you and telling you all these horrible things and bullying you. And then you now are like me, 5 years later, I'm 16 years later, proving these doctors wrong and showing them that they're not communicating in a healthy manner to help women.
No, they honestly aren't. And like I said, I'm 69 years old now. When you were saying about them wanting to prescribe, basically the anti-anxiety, drugs and the psych drugs. What does that have to do with DCIS other than, do they want you not to not to think about it, not to question it, just to accept it. That's
Yeah.
no,
It's terrible.
this,
They know they're giving you an anxiety disorder by the way they present it, by telling you you have breast cancer and you may need this, this, and this, these horrible, very extreme aggressive treatments that really don't, it's incongruent with what the condition is. It's not even a precancer. In 85% of the time, it's nothing. It's just nothing. It's not, you're going to end up dying. We all die. We're going to die from something else, so it's really just a trauma in a lot of women's lives, emotional trauma. And this is what I think our group helps women with, because we're there to support one another, which isn't available in the medical community.
No, it isn't. And it's always in the back of your mind. At first, for the first year, it was always in the back of my mind, that I had this. It kind of, it never really goes away. As time goes on, you kind of accept it. And the only medication I'm on is asthma medication. And I'm 60. I'm going to actually, in May, I'm going to be 70 years old. The only medication that I'm on is asthma. And the wellness woman that I went to lose the weight, she wasn't concerned at all about the DCIS. She had the same kind of thought process, that we have on it, that they're really scaring women. It's not my intent to come on this to try to persuade everybody to have my way of thinking or to do what I'm doing or anything. I'm just on here to share my story, what was not told to me that I knew to be a fact to confirm. I'm just on here to have women, please do your research. The first thought, even mine, the very first thought when you hear this, even after I did transcription, was get it out, get it out, get it out. That is your very first initial
knee-jerk reaction.
Yes. And then, but what you need to do, you need to stop, you need to breathe, you need to research everything and make an informed decision. Don't schedule something the following week or buy into the fear-mongering or the threatening or the bullying or the trying to scare you that you're risking your life. I'm just here to tell my story and for people to make an informed decision. So to end my story, I decided that when I would go to the PCP last year and this year, he understood that I did not want to get mammograms. And I told him about the COMET study and what the results were showing. And he said that he was definitely going to look into this because he was unaware of this. So he told me last year, if you don't want to get a mammogram, I understand. Let me give you a script for an ultrasound. It's low radiation because then at least, it will detect if you have any, growths or tumors, which I do self-exams. Nothing's going on here with me. I didn't do it last year, but I just went for a physical last month and got all my blood work. And he brought it up again, I'm open to just giving you a script for an ultrasound. So I thought, well, maybe it would be a good idea. So I called the facility where I got the biopsy 5 years ago. And I was told that they will not do the ultrasound. They said that unless I do a mammogram, they will not do the ultrasound. So she put me on hold because the person that I talked to, the clerk, was very understanding. I think she kind of sided with me, but really couldn't say. She said, let me see what I can do. I'm going to put you on hold. And she came back and said, they just said that, they have to do the mammogram and then the ultrasound. She said, but they said to go ahead and schedule the ultrasound, which I did, but that they can't guarantee that they're going to do it. So what that means to me, I'm going to go. I scheduled it. So I know what's going to happen. The radiologist is going to come in and do the little bullying again, tell me how it's pointless to do the ultrasound without the mammogram. But I'm going to play the game. I'm going to go, but I am not going to get the mammogram. And I'm just going to say to him, so basically, you are denying me the ultrasound. When he starts to go on and on, I'm going to say, no, I don't want to hear anything else. I'm just asking you a point blank question. I am requesting an ultrasound. Are you denying it? So yes, I am going to go, but I know that they just scheduled it to preface it, telling me that they can't guarantee they're going to do it because I know the radiologist is going to come in and do the bullying and then they're not going to do it. And I'll go from there. I did call my PCP office and then they said that maybe it's an insurance issue, but I don't think they're worried about the insurance because they know if the insurance doesn't pay, they're going to come after you personally to pay. So when I get a chance this week, I am going to call the insurance company to see if they would pay if I go to another facility. But I'm going to keep this ultrasound appointment and see what goes down.
Great.
And that's kind of my story.
Well,
and I just hope by sharing it that people won't accept at face value, because again, there's a lot that they do not tell you that you need to know in order to make an informed decision that you feel is right for you.
Absolutely. Well, thank you so much for sharing all that. And, you know, your experience with wanting an ultrasound only is very, very common. And this is a big problem. And that's why I put together like a mammogram opt-out letter that, you know, it's all on my website for free. I have an ebook about the harms of mammograms with all the studies and all the experts speaking out. It's not my opinion. It's 200 pages of, you know, expert statements. And, you know, giving people, you know, just in the general public, like you and I, who want to, you know, have certain tests or not, you know, just have options to not be bullied, to feel confident that we are making educated choices. We're not being foolish with our health. And I've done so much research, and that's why I put it all together for people to have these resources. I have a whole checklist, you know, with links and, you know, ways to really just advocate for yourself. So
I agree. You're doing a really good thing, you know, for women, because women do need to be aware of this. I mean, when I think of the women who went through unnecessary procedures, my heart just aches for them. And I read on your website, on the Facebook site, the women who regret that they really did not look into this more before they did these invasive procedures.
Yeah. Well, they schedule you right away. They make you feel like it's urgent. They do it to everyone still. It's 16 years ago for me, but it feels like yesterday. You never forget the way that you're talked to and treated. It's a little bit abusive in a way but you know something's not right. Even for me, I was very naive. I didn't have all the knowledge you came into this with, but I knew intuitively that it wasn't right because of the way I was talked to. And so I started researching, and I found, you know, experts and doctors speaking out about overtreatment, overdiagnosis. They were talking about active surveillance. We need better biomarkers. There's issues with this. So it's not like, you know, it's not clearly, you know, and experts are arguing it's not breast cancer.
Right.
So, but anyway, I just want to wrap up because we are running out of time. I just want to say thank you so, so much for sharing. And you're such an inspiration. You're just like a bright light, and you have so much knowledge and wisdom. And thank you for sharing in our group and sharing today on this podcast. And may we bless everyone with more inspiration, and more women will come talk on this little wake-up call podcast, so that, you know, we're not just a few people, the numbers are growing. We're now a movement. We've been called a movement.
Thank you for having me, and thank you for asking me. I'm happy to get my story out to people. If it can help even one person, then that is a good thing.
Well, thank you so much.